Good evening, everybody. It's indeed a great pleasure to have in our midst a very knowledgeable and experienced person, Dr. Nisha. We know her very well. She's a colleague, in fact, and we are very grateful to you, madam, for accepting our invitation and being part of this 3-day international webinar series. A hearty welcome to you, madam, and also a hearty welcome to all the participants, young and elders who are taking part. Thank you, children, for organizing this. Thank you.
Thank you.
Thank you, ma'am. Next, I would like to call Srimati Meera DK, Assistant Professor, Department of Home Science, for introducing the resource person. Over to you, ma'am.
Thank you, Nigita. Good evening, all. It's my pleasure to introduce today's speaker, who is our alumni too, Dr. Nisha VIKRAMAN, Assistant Professor in Home Science, St.TERESA'S College. She got more than 20 years of experience in teaching and research field. She worked as a project manager of Rajagiri Outreach Service Society and also act as a state-level coordinator for White Ribbon Alliance Kerala. She's the Vice President of ARDSI Cochin Chapter and also Treasurer of Home Science Association Kerala Chapter. She has bagged many awards in her career as a student. I'd like to thank you for joining us today for the presentation on topic Dimensions of Dementia. On behalf of Government College for Women and HSI Kerala Chapter, I welcome you, ma'am, to deliver today's session. Thank you all. Over to you, ma'am.
Thank you, Meera. Thank you so much. Hope I am audible. It gives me great pleasure to join back with Women's College, from where I really and truly belong. All my teachers are there, and it's a great moment for me to present it before all of you, who are all going to be alumni of my college, actually. I thank the Home Science Department, Bini Ma'am, Sitara, and all for giving me this opportunity to present on dimensions of dementia. So let's go ahead. Let me give the talk, and then we will have time to clear your doubts if I delay a little more time. So I am presenting my presentation here. Not a normal part of aging. And dementia can affect young people also, though rarely. And there are several different diseases which can cause dementia. And there are more than one form of dementia, that is mixed dementia, that exists in the same person also. You can, as you grow older, you will be sometimes seeing these different, or if you have seen certain elderly people, you would have seen these symptoms of what I'm going to talk about. Now, you have to understand basically that dementia is a general term to describe a group of symptoms which occurs due to damage and death of brain cells. And the common symptoms, if you can say, is the impaired memory, thinking, language comprehension, judgment, decision making, and orientation. So it's a progressive condition, and the symptoms get worse over time. So that is why it is a progressive kind of disease. So even the slight change, we have to have a checking in between as the age advances, because we never know for what reason we are getting it. And if it is dementia, if the reason is dementia, then we have to be more cautious. So there are behavioral and personality changes which will occur, and the person will be unable to carry out activities of daily living. Imagine living a life where you don't know what is happening around you. You don't know what to do. Or you might be sometimes doing things which you don't understand. Or there is no connection with you, the person. So let's see how similar you are with the symptoms cause treatment. You might know about diabetes. You might know about asthma, kidney failure, cancer, stroke, heart attack, arthritis. All these are diseases, and you know the cause, you know the symptoms, you know the treatment and everything. But how familiar are you with dementia as such and Alzheimer's, which is one of a kind of disease related to dementia? Actually, everybody confuses this terminology, dementia and Alzheimer's. Now, dementia is actually, the disease, and Alzheimer's is actually the symptoms which is related to it. And dementia is prevalent, and it is on rise in all the countries. And the major part of it is that it not only affects the person, but it affects the whole family, and finally the community as well. So that is the greatest impact of the, if you are getting dementia. So when we see strange behaviors, especially in elderly, you might have seen it also, when you interact with certain elderly, you might have seen they will repeat themselves, and they'll be very paranoid, very suspicious about what they will simply, they will tell you, no, you're planning to take my money and all that. And they'll get irritated and angry for no reason. And they'll also forget. You will see that they might be very friendly with somebody, but suddenly they are not talking to that person. A very great buddy but they might not be. And without any reason, they are depressed and they seem to be very confused. So do you think it can be something related to a normal aging process? Generally, it is assumed like that it is something very normal with the elderly. Now, specifically, you have to understand that dementia is a general term used for progressive loss of brain functions that affect the ability to live and increase dependence on others. And dementia is not part of normal aging, and it causes memory loss. It affects thinking, speaking, making decisions, and it interferes with the ability to perform normal activities of daily living, like shopping, handling, cooking, finances, driving, personal hygiene. All this is affected. They start behaving differently. Even the sleep pattern is totally different. They cannot sleep in the normal timing, or they will sleep at odd times. There is wandering. That is, they will be with you, but suddenly they will not be seen. They will be going out and roaming around without any direction, sense of direction. They will just move away. There will be apathy and aggression also, anger. Sometimes it does get destructive also. So in the final stage of dementia, the patient is completely dependent on the caregiver or those who are going to take care. So actually, if you are a caregiver, you will know the depth of what I'm telling you. And even if you are not a caregiver, you can just imagine, if you have an elderly person in your home, that how these things, once a person who was very active, who was the authority, suddenly there are certain characteristic changes that is happening in their functioning, in the normal, daily living practices itself. We have to be cautious. That is the time we have to be cautious. It is not normal aging. So now there are types of dementia. You cannot say that all dementia are not reversible. Now there are irreversible dementia also, and which are called as vascular, frontal lobal, Lewy body, and they actually bring about physical changes in the brain. And Alzheimer's disease is the most common. Approximately 50 to 75% of dementia is Alzheimer's disease. And dementia can occur after stroke because of other abnormalities in the brain. A person can have more than one type of dementia, and it can also be caused, due to deficiency of vitamin B12, hyperthyroidism, depression, and all. And these are reversible dementias. So if you give medications, if you are able to identify it in advance and you support it with medication, actually we can help these kind of dementia. So who gets dementia? Dementia knows no social, economic, ethnic, or geographic boundaries. It can come to me. It can come to the most intellectual president. It can come to a sports person. So anybody, if there are certain examples to be given here, and it can come, to most of the time it has come to people who have been very active, and suddenly after their retirement they have stopped doing everything, and they have started living the retired life and have cut down all their activities to a minimum, uh, so which can actually aggravate this chances if they have a tendency for dementia. And typical onset is after the age of 65 years, but in some cases like 30, 40 years also. And there was a Malayalam film on that. So it can come early also. It can come in 30s, 40s. It means the onset will start early, and later on the disease will progress to its maximum, though it's rare. Now, if you see the prevalence of dementia, why are we worried about dementia? Now, there was a doctor called Dr. Roy in Kerala who actually took up a very great initiative, because his father at the age of 63 was suffering from dementia, and he took up certain initiatives which led to a lot of a mass movement in Kerala itself. It was way back in 1992, and all he started doing. At that time, his father passed away, and he started taking action into it because he was also a doctor, and he realized that nobody is aware of such a disease, and that's how a society was formed. There was a representation from India, and UK was generally already concerned about it. There was Alzheimer International there, and they were already working on it. By then, if I can give you a 10 years comparison of what it is, there was a report in 2010 by Alzheimer's Association, and at that time the statistics showed that Alzheimer's disease was the 7th leading cause of death across all ages in United States in 2006. So it was the 5th leading cause of death for those aged 65 years and older. So more than 20% of the women, here again, the women are, they are given the priority, but unfortunately, for a wrong reason, yes, women have chances of getting Alzheimer's more than men. So, but those who have reached the age of 65, there was chances of developing dementia, and 17% of the men also. So it is an estimated lifetime risk. Now, there was a report again done on 2015 where it showed that about 46.8 million people lived with dementia worldwide. And this number was supposed to increase to 74.7 million in the coming years. That is to 2030. And by 2050, it is going to be 131.5. Imagine a world of people living without memory. And if you see the statistics in India, the Dementia India report in 2010 was estimated as 37 lakhs. It's 3.7 million. And again, the same report, and it was done in 2015, it is estimated to be 4.1 million prevalence of dementia. And we stand number 3 in the world. India will stand 3 in the world because our population is also more, and we have the strength to cover a large, because we are not doing anything much in this field. So it is estimated that by the age of 60, dementia in India, that is in 2022, and this year again the report has come up, and that's when we come to know that we have a scope of standing 3 in the world in statistics. So what are the warning signs? Let's see. So memory changes and will disrupt our daily life, challenges in planning or solving problems, difficulty completing familiar tasks at home, work and leisure, confusion with time or place, like you are really confused whether it is morning or night, where am I? So all this will happen. Suddenly you need time to recollect where you are and what you're doing. Trouble understanding visual images and spatial relationships, new problems with words in speaking or writing. You will be trying to look out for words to add into your sentences or to place it. while you're writing, while you're speaking, misplacing things and losing the ability to retrace the steps. That is, you become cautious even when you're climbing or you're walking, you have a difficulty. And that is basically because of poor judgment. So withdrawal from work or social activities, you won't feel like putting in as much as you used to. So there is a basic change in the mood and personality. So these are actually warning signs. But believe me, all these signs doesn't particularly tell you that you are going to have dementia. So that is why the testing part is important. But yes, these are warning signs that some change is happening in your life and you need to pay attention. So it might be you, it might be for a loved person that you have in your life, your parents or your husband, or might be the wife, so whoever it is. Now, how do you diagnose dementia? So if you suspect that you or your loved one or any near one has dementia, the first thing is you have to meet a general practitioner, basically a neurologist, and they will generally we have it in Ernakulam. We used to have in Indira Gandhi memory clinics, and here also there are a lot of clinical psychologists who are helping with the memory clinics. There are doctors, psychiatrists who are working on it. So basically, it is a neurologist that you should meet, and you should go and tell them about your problem. Your neurological evaluation will be done, a memory orientation will be done, mental ability test. There is a small sheet of paper. Actually, we cannot do it with illiterate people, but yes, with literate we can do the memory testing. But we do have another memory form wherein the drawings are made and they are asked to relate to it, like a clock and all. Ask them to draw what is time and all. Please say 4 o'clock. Can you just switch the arrows, correct marking of arrows and all. So there are certain questions which are asked. There are a series of questions which we evaluate to guess. That is a memory test basically, and then there are blood tests to detect whether it's a reversible problem like hypothyroidism or vitamin B12 deficiency. And brain scans and all are done generally. If there is a chance of dementia occurring, then they will try out all these just to be sure about the status. Now, when what and all brain does. So this is just I've posted a picture of our brain and all the beautiful activities which make us do all the things that we do, and we are so proud of. Now, see, if the brain was not there, you cannot remember anything. You cannot think, you cannot talk, you cannot listen, you cannot see. You cannot use any part of the body. So the examples of problem faced, if the brain is not functioning properly, you will forget the name. Naturally, there's no brain. So forgetting where you are, what you want, you will not notice whether it's hot or cold, whether you can walk properly, whether you're able to balance yourself. You will forget your steps. And you will forget even, you might have kept tea for boiling. You will forget that you've kept it. Yeah, it does happen to normal people also, but that doesn't mean that you have dementia. Further tests will prove that you have chances of developing dementia. Now, how will this dementia disease progress? So it actually varies between different people. Early on, the persons may become forgetful or behave unusual, like they won't be their normal self. And the person may realize that something is wrong and different, and people also react to them differently, and which will actually start creating depressions for them, and they will need more and more help. A caregiver has to be there, somebody near one. If it is a husband, the wife will have to help. If it's the wife, the husband will have to lend a hand, mother, the children. So all this, they might need more support from the near ones. Some of the difficulties that they face is that they have what they have in the starting, sometimes they don't have, and they're very clear about what has happened very early in their life. They talk very clearly about all the things in their younger times, and they're very clear about the words about the older people. But the near ones who are with whom they have been interacting, they won't be able to even remember the names. So that and all shows us that this disease is progressing in a different level. And there are many ways to make life easier and happier for the person with dementia and caregiver. Here, why we link the caregiver with the person with dementia is because, you know, imagine if you have to be a 24-hour caregiver of such a person who cannot think for themselves, who cannot do things by themselves. So you are totally committed. You don't have the caregiver, even though the person is all okay, has no life of their own. The life of the caregiver becomes dependent on the person with dementia. Now, let me just tell you very clearly how a healthy brain will look and how a severe Alzheimer's brain will look. So this is actually showing you the PET scans also of the normal brain and the Alzheimer's brain. All the cells are actually getting finished. So it is degenerating. So all the healthy brain that we use, slowly it is getting damaged. The neurons are getting damaged. I've just given you a comparison of the neuron and the diseased neuron, and what is actually happening inside the healthy neuron and what is happening inside the diseased neuron. So it is called, if when it is diseased, it's called the dying neuron. Now, dementia is not the same as normal aging. Normal elders may forget part of this. They might remember the experience later after some time. They will understand and write, and they take little time, but will speak later. But they can remember the notes. Sometimes they will forget, and they take care of themselves. They can do their normal daily living activities. Now, a dementia patient forgets the entire experience. Usually, they don't remember even later. Even if you ask them later, do you remember? No, they won't remember. Slowly, they lose the ability to understand any directions as well. They will be just, staring at you. They will have no idea of what direction they have to move. Judgment part is nil. So they do even the reminder notes. Some people they use diary. When they start losing memory, we also do that. So we start writing diary. We write the important points. Now, in the case of dementia patients, they even don't know that they have written that diary and they have to check it then. So that is also lost. So they lose completely the ability to take care of themselves. So dementia, it will affect the memory, insight, ability to plan, information processing, ability to reason or learn new ideas, even the language skill, filtering system. They sometimes you will think that how can they be so blunt? Yes, this is also one thing. Filtering system, orientation and spatial awareness, pain perception, the tolerance to stress. They might be going through a heavy stress and they cannot take in that much, and they cannot control mechanism is completely gone. The eye-hand coordination, all that is affected. Now, the patient's behavior, if you see, it changes because of the dementia problem. They cannot understand what is being told to them. They will respond totally differently to what they used to respond, and will show strong emotions like frustration, rage, withdrawal, and you will be they might use languages which will frustrate the caregiver also. The other person will, generally it is thought that they are purposely saying this, statement. Usually, if it is between the daughter-in-law and the mother-in-law, it becomes a big issue. Actually, it might not be the issue of their personal relationship. It might be that the mother-in-law is going through a stage of dementia where she is, making all this. There are chances of that. So it can, as after 65, you can expect all this as chances. So sometimes the patient's behavior can harm the other patients, especially the caregiver or the people who are near them, and they may happen to cause some needs which are not like in the physical or emotional needs, which are not met. And they might, they will usually fight. During my research, I see, the most of the complaint that the elderly give is that they are not given food. They might have been served the food, they might have finished the breakfast, they might have finished the lunch, they might have finished the dinner, but they will say that today whole day I was not given food. They forget that they have taken food. So the basic system that is happening also, they forget. They prevent and handle such behavior. We have to actually teach the caregivers to handle such behavior. The caregiver has to learn to talk to the patient, and it needs the really good amount of patience to handle. And you can understand in the new generation, I don't know how they will be able to take unless they are prepared for the changes that is happening, and if if God forbid they have to face such a situation. So what are the stages of dementia? There are actually 3 stages of dementia, which is early dementia, mild, and mild to moderate, and then late or terminal stage. Now, it will last anywhere it will go for a couple of years. It can go to 10 years, it can go to 20 years. A person who starts at the age of 40 years will continue. There's nothing wrong with the person. But so the caregiving will also happen. So you can imagine the more stress is there on the caregiver, because if the person with dementia is say 60 years, and the person who has to care for the person is about 30 years, and this person lives more 30 more years, then the caregiver has to take care till he or she is 60 years. So that is why in dementia, they give so much importance to the caregiver, because they are the ones who need more support and understanding, and they are doing something which really needs a lot of patience and efforts. And death here is usually due to comorbidities. And understanding of stages of dementia help us plan them. So it is not something, see, a fully healthy person cannot remember, and that person has to be taken care totally. It is like taking care of a baby itself. So in the early stage of dementia, the patient will face a small level of memory problems and is unable to do complex things, will be unable to learn new things, and will be little disoriented about date and place, and may wander and will get frustrated and withdrawn. And it will go even more further. The patient will often forget the recent events but remember the distance past. They will be very clear about the past, but they will not remember what happened just immediately, and will be again confused about the time and place. Wandering is one of the risk factors that will happen. So this is another thing that has to be taken care. See or hear things that are not there. It's like something like hallucination. They will see and hear things which a normal caregiver, a normal person, will not be hearing or seeing, and they will also become repetitive. They will often neglect their personal hygiene and appetite. Sometimes you will get the food, they will feel, they'll eat it without any control, or sometimes they will not even look at the food. And they will become sometimes, some days, they become passive and withdrawn. They will not even respond. And so the need is there to help them for with the bathing and hygiene, toilet, wearing clothes, combing hairs, making them walk, and they of course just like if I say like the babies, then they lose they lose control over the urine and bowels also. They don't have control. So that is also there. And when it reaches the final stage of dementia, the patient is unable to recognize family members, is unable to talk, does not understand anything, sleeps most of the time, and is not aware of the environment, becomes completely bedridden and totally dependent. Even swallowing of the food, they forget. If you give them a spoonful of the food, they will forget to even chew it down. They dribble it down. So at that time, sometimes it can go to the lungs, and the patient might get choked. So they get infections also easily, and incontinent, like they cannot control the bladder movements and bowels, and is withdrawn, insecure, and are always feeling threatened most of the time. They're scared that people come in, and it takes time for them to be then to understand, or they are not able to relate to the person. So the goal here of caregiving is to give comfort to them. So And some medical facts about dementia is that you have to understand that dementia is not infectious, and it usually affects older people above 65 years age, and early onset happens. Sometimes if it is below 65 years, it is called as an early onset, such as 40 or 50 years. But it can happen. And many diseases can cause dementia symptoms. Diabetes is known as dementia is known also as type 3 diabetes. There have been studies happening because there's a very close relationship between diabetes and dementia. Even cardiac patients, they also generally have more risk of dementia in the as the age progresses. And if there's a family history of Alzheimer's disease, then the probability is more. So that means that there is a gene. So at early stages also sometimes the progression can happen, and you cannot stop the progression of the disease cannot be stopped. But you can slow down the progression of disease with medication and support. So if a person is to have the chain has proven, then you have to immediately make sure the person of the dementia is under medical care, so the progression of the disease can be controlled, which will give a great relief to the person. So what may help if we delay? How we can help? By giving healthy diet, which should include fruits and vegetables, and exercise should be there. A minimum 30 minutes walk should be included. As you age, you have to take certain precautions so that you don't get this kind of diseases, where here you have to keep the brain active. That is, the TV is not helping, and unfortunately our elderly population is totally dependent on the TV, and which is going to be a great threat in case of dementia. That's why we are more and more worried. And stay free of lifestyle diseases like high BP, diabetes, cardiac, and you have to maintain a good social, that is active social life, and also a stress-free life. Learn to leave away things, not to take everything on your head, and of course, protect the head from injury. As you age, the body's aging process gives certain threat to individual. So we have to be more cautious. We have to let go of doing certain things which we are not confident about doing. There's nothing wrong. You can take care of yourself. Your priority should be first yourself, protecting yourself, and delaying complications during the elderly life. So what is dementia awareness in India? Dementia awareness is very poor in India. There are a lot of studies being done, and there's a great demand for young people to come in and to be cautious about it. And family members generally speak of weak brain, and they say that it is a natural phenomenon of aging and all that, and they believe that dementia is associated with family. The people are not taking care of them. That's why the elderly has got this. It is nothing like that. It has nothing to do with that. So, actually, an outsider sees a patient really wandering out. They hear of all the accusations. They think, okay, these people are not taking care of the elderly at home. That is why they are shouting. But actually, it has nothing to do with it. It is just the progression of the disease. So a caregiver has given a quote: a family member thinks we are the cause of his illness, and we think we still deserve all that is happening to it. It's like, something, a curse. You have not taken care of the elderly, so you have to bear the brunt. It is something like that. So this stand of the community putting the burden of guilt into the family is creating an extra baggage of problems, or problems for the caregiver who is already struggling under all the problems that we have just spoken about. Okay, so there are multiple facets of dementia care, and as the dementia is on rise, more and more people are affected as patients, and Not only patients, as I told you, caregivers, support dementia care through policies, facilities, and volunteer work. And researching dementia causes, the treatment, risk factors, and caregiving interventions, all that has to be taken. Spreading dementia awareness to enable earlier diagnosis and better support of the patient and caregiver. Giving all kind of support to the caregiver, strengthening their support, not to leave elderly. Actually, in India, we have got a better culture. We take care of our elderly. We have our parents with us. There is no system of the children moving away as soon as they're 18 years old. So that system is actually helping Indian scenario to to deal with dementia. And also the families are not hesitant to take the patient dementia patients to hospital. They want to give the care themselves, even though there is a lot of hardships, but there are people taking care in India. Especially there are a lot of situations in the in the middle class, in the lower level, and because of the better facilities, yeah, there are chances that the diagnosis possibility is better with if you have a better income status. But yes, still the people and at all the the low income level, they take care of the elderly even if all the problems are there, and mostly they treat it as a major problem and they don't understand this as a cause, the reason as dementia, and they don't look for support. So here we have to definitely think about one person. We have to think about two, that is the person with dementia and also the caregiver. Now, the caregiver support is done in multiple ways. There are training given. Here we are in Kerala, we have the Alzheimer's Society. In Bangalore, we have all over India, ARDSI, Alzheimer Related Disorder Society is there, which gives support, and they are giving trainings, they are giving daycares, they are giving institutional training. So it is going on in different level. And even it is given, they are giving the caregivers, they can go there and get training to how to do a 1 week training like that also they are doing. So there are also support groups. I and all are part of the support groups which create meetings, facilitate respite care, daycares, trained nurses and attendants are taken to ease the work and stress of the home-based patients, and home-based medical and nursing care is given. Counseling and support is given for the caregivers, because there are a lot of tough decisions they have to take. It is really, really bad for the family to decide. You can put yourself in that situation and think to take a decision like that too. That is, if you take away the life support system, the person is no more. You have something else. So there are many palliative care decisions that is taken, and dementia care homes for patients are also there who cannot be cared at home. And of course, the government hospitals, they are opening special wards for such kind of caregivers. There are initiatives. I have also personally given certain, there are dementia care tables, support tables in government hospitals, so that there is a special area where you don't have to meet any doctor or any other person and go directly to the dementia care. Now, the role of the caregiver is critical for dementia care, and we have to definitely understand people caring for dementia patients may be sad, tired, upset, distressed, and they are looking at care of, taking care of people they love. It might be their parents, and so they, in turn, they might not be giving the good life to their children, and there won't be any family holidays, talks, movies, etc. And because of the poor awareness of dementia, they will not go for diagnosis, and outsiders will think that person is the diagnosed parents. So all these kind of things happen with these. There are a lot of blame game that they caregivers. As a caregiver, you can understand the behavior is because of dementia, and they themselves will give some kind of settling, support, and they learn to talk to a person with dementia. They will learn also how to handle the agitation. They will also get community support. There are like now we're talking about ARDSI who are continuously giving support programs, and they will teach them how you have to interact with the dementia patients. Just like you talk to the children itself, you have a box. It is with all the spices, and if you take it to them, you ask them to smell it and tell the smell of it and identify the spice. So that and all they are able to do. They relate them to older things, giving them the old photographs and letting them connect to it. So there are a lot of activities. Music plays a very important role there again. So they are agitated because caregiving is easier and more pleasant. If there is no agitation, if they are comfortable and they are at ease, then caregiving is much more easier. So even if the disease progresses, can handle it. So the friends, relatives, and family can of course help. They can exchange plates for some time, make the caregiver go and have a time for themselves. Giving a break, run errands for them, provide them emotional support, and do as many things as they can to take away the burden from them. And if you are genuinely concerned about dementia, if you really want to do something about it, you can join walks. Students can create awareness of dementia with the voice of the teaching caregivers. There is funds work, get test scores, participate in drug trials, and fund research. Recent students, two of them, they have two books. One is a handbook of resources for dementia, persons with dementia and caregivers. So all over India, whatever resources are there, they made it form of a booklet, and that is going to be published, which the caregivers can use. And there is another project which was done, which was a hand manual for dementia patients, where they can write down each day's activities, medication, all this, plus information about diet, checkup, all the dates, everything. It's like a diary with all information. So two was like that, and various students and they have fun like. So students can definitely help in this. So I hope my questions diagnosis of dementia due to Alzheimer is one of the reasons that we have to relate it. So there's no particular single test for dementia. So physicians will put in a test such as the neurologists, neuropsychologists, geriatrician, geriatric psychiatry. They all have various tools and diagnoses, and they will do all that. And of course, the family should be different, including the psychiatric history and also evaluation on cognitive and behavioral changes. The family, will be asked to think about the behavior patterns, and they will, then the memory test will be done, and the blood are done also. Imaging is done in the case, and they are compared with the normal levels. So there is an active management of Alzheimer's disease, that is dementia, and we have to make effective management is the secret of everything, and the family caregivers play a very important role in getting the information and doing it the right way, which will help to both the patient and also the caregiver. Now, dementia is, in summary, I would say that it's a progressive loss of brain functions that affect the ability to live and increase dependence on others, affects memory, ability to understand and talk, and ability to do things. And many diseases can result in dementia symptoms. So we should not misunderstand this to be dementia. And it usually affects older, and that is the normal age, but no, it can also affect the younger ones, a rare chance. And medical science is not really certain about its prevention or its cause. A lot of studies are happening. It's an area to be explored, and there is no cure for it. We can only control the progression of disease. And maybe and we have this really chance reduce the risk. Prevention is very challenging, as you already, and together has learned about dementia and made
Excuse me, Nisha ma'am, your voice is breaking.
Can you hear me now?
Nisha ma'am, it's breaking, ma'am.
Yeah. So, yeah, I have conclusion. So, with love, compassion, and patience, nothing is
It's
possible.
not
And that
clear,
is what
ma'am. Okay,
people
ma'am.
with
Please continue.
dementia. Yeah.
Ma'am,
Yes, Atura, can you hear
yes,
me?
ma'am. Now it's clear, ma'am.
Yes, ma'am.
Yes, ma'am. Please.
Till now it was not
Now
clear.
it's very much clear, ma'am.
Okay. So, with love, compassion, and patience, nothing is impossible, and that is all what can be said for people, who cannot remember themselves. You have to remember for them. So it is like remembering people who cannot remember for themselves. So with this, I conclude my presentation. And look forward for your.
Thank you, Dr. Nisha Vikraman, for the wonderful presentation. Now the session is open for discussion. Participants are kindly requested to share your queries in the chat.
I can't. Sorry, I can't hear you very clearly.
Ma'am, are you? Am I audible?
Yeah. Now you're audible. Thank you, Nikita. Yeah, fine.
Okay, ma'am. We are going into the discussion session.
Yeah, sure.
The
I
first
can see
question is,
something. Yeah.
which are, ma'am, am I audible?
Yeah, Nikita, go ahead. I can hear you.
Okay. Which are the comorbidities associated with dementia and whether this shows genetic predisposition?
Sorry, is it Bhagya's question? Where are the comorbidities associated with dementia and whether any studies show genetic predispositions? Is it the question,
Yes,
Nikita? Can
yes,
you hear
ma'am.
me?
Yes, ma'am.
Yeah, is it the question?
Yes, ma'am.
Yes, ma'am.
Yeah,
Yes, ma'am.
yes. The comorbidities associated with dementia is what I was just listing. So all the things that I have listed just now, I have been talking about even the health conditions and also genetic. Yes, genetic. If the fathers, if the person's family, anyone had dementia, then there are more risk of dementia occurring in that family. That is one of the first cause, which is irreversible cause. We cannot do anything about it. Okay. And like I was talking about, all these cardiac diseases, hypertension, and also the diabetes, which I mentioned is the type 3. Diabetes is actually in the international scenario addressed as dementia. So all, yes, it is definitely there. There are studies, lots and lots of studies that has happened. Women, I think Shama ma'am has asked another question. Women are more prone to dementia than men. Yes, ma'am. Yes, it is true. Women are more prone to dementia than men because generally one reason is this, that the men are more in, if the women is not into any intellectual work, or they are not working, because the men are doing law. It is generally seen that they are going out, that they're working, and they're doing this is especially seen in the category of the low income level, because the men go out, they interact, they have a social life and all that. The women are confined to the home, and they have got the similar activities, and there's not much of thinking process happening. And if then as they grow old also, the responsibilities are taken away from them, and the daughter-in-law will take up. And so as they become inactive, even if a very active person suddenly after retirement becomes inactive, that is one of the risk factors of developing dementia, chances of developing dementia. So that is the reason why women have more prone to dementia than men. Men, even if they retire, they keep the social activities, they move around, they go about doing their things. The women, they stay at home. They don't go out and they don't go in for the social life and activities. If they do go, then yes, the scenario will change. They have to be more engaged in their life. Yeah, Nikita, next question.
Ma'am, can I?
Yeah, sure.
Ma'am, the next question is, what are the precautions to be taken to get rid of dementia from early period of life?
Yeah, Athira,
Yes, ma'am.
if you've got dementia, then there's no way of getting rid of it. You can only control it. Okay.
Ma'am, it's actually from Gitika from Assam. It's her question, ma'am.
Gitika.
Yeah.
Okay. Okay, Gitika. See, first thing is when of this particular age, from this young age itself, you should learn to have a system in your life to be more active, to do exercise, to have vegetables and fruits, lead a better health conscious life, be intellectual, read more. Not giving much time for televisions. TV is actually fluctuation of series of images in front of you, and it creates nothing, no imagination. When you're reading, you actually imagine the picture in your mind. There is a lot of activity that is happening in the brain. So actually this TV watching nowadays of all elderly also, it is actually making them prone to dementia. So all these things, you have to do the brain crackers, the brain teasers. You have to do all the calculation where you have to use more of your brain. Start thinking. If you are not able to remember, do memory activities to enhance your memory. So keeping your brain active is the only way of and keeping your body active and healthy, under control, no disease, is the only way that you can rid of occurrence of dementia in your life. So that is how you can actually take care of it. Yeah.
Okay, ma'am. Thank you, ma'am.
I hope I have answered your question.
Thank you so much, ma'am. Thank you so much.
Yeah.
I'm Gitika from Assam.
Yeah, Geetika.
Thank you so much.
Yeah.
Yes, ma'am. Yeah.
Okay, thank you, ma'am. The next question is, what are the measures that caregivers can provide for ensuring better quality of life for the elderly?
Elderly. It's your question, Asra.
Yes, ma'am.
Okay. So see, if you have an elderly person who is having dementia at your place, then you first and most important is don't isolate the person in your family. Never isolate the elderly. Generally, it is the tendency of the new generation family to leave elderly aside and continue with their normal social activities. Always involve them in your life. Very important. The caregiver should not isolate the person from the family. The care should be taken along with the family. Number one. Number two is that the caregiver should also ensure to know about, learn more about the techniques of caregiving. There are lots of techniques, how to handle them, how to give them bath, how to make them do the daily activities and all that. So there are this ARDSI is there in Trivandrum, it is there all over India. So they will actually tell you the easier method of doing it. So learning that. When you do it in the wrong way, you get more agitated, more depressed, and more stressed, and that will affect the quality of your caregiving. So that is what you have. The caregiver has to link themselves with the nearest Alzheimer's support system, wherein they will get ready support, and even if there is a problem situation, they can look for help there. Okay.
Okay,
I
ma'am.
hope I
Thank you.
answered your question.
Yes, ma'am. Ma'am, the next question is there any research that proves that women are more prone to dementia as compared to men?
Is it is it Lakshmi ma'am's?
It's
No, not
Ampika.
Lakshmi.
It's from Ampika Sharma, ma'am.
Oh, okay, Ambika Sharma. Yes, there are lots of researches which is being done to prove that women are more prone to dementia as compared to men. For the reason I just stated, Because when a man retires, they will either look into some activities, and or they will have their friends to go about. They will have their social activity has to be maintained. They will be thinking. They will be moving around. They will go for walks and all. Generally, the women has a tendency to stay back at home. If they retire, they will not look into any other activities. They will do for some time, and then slowly they will start relaxing at home, and they will not. They will, most of them, they will not look into reading books, or they will stick to watching more movies and what do you say, serials and all that. So these are one of the main reason why a woman is more chances of getting dementia. More, like I told you, more brain activities, more activities related to brain movement and social activities has to be incorporated, and plus exercises and healthy living style.
Thank you, ma'am. I hope Dr. Gayatri got her answer too. The
Yeah.
next question is there any new treatment strategies for dementia?
New treatment strategies for dementia is just this. The main priority is creating awareness, creating support system, and as much as possible to decrease the progression of the disease. That is the new strategy that is related to dementia. You have to control the progression of the disease. So a person who might deteriorate within 5 years, if you will control, the person will deteriorate only after 15 years. By the time the person's age also will increase, it will become immaterial, even if the person loses the coordinations and all that. At that time, you can still handle. So the most important strategy in the new treatment method is, of course, there are a lot of medications also is being given, but all the medication focuses on decreasing the progression of disease. Okay, slowing down the progression of disease.
Thank you so much, ma'am. Another question is, can you suggest some stimulating activities which are good for dementia patients?
Stimulating, yeah, definitely. The best is the brain gym, brain games. All the crosswords that you have to, make it a habit. If you see, a certain elderly, they will be doing, earlier, I think in the newspaper and all, you used to get crosswords and all, and people used to sit them. But now that the TV has come, people have forgotten all those kind of things. So yes, brain teasers, doing more brain activity, reading. Reading actually activates your mind. It creates images in your mind. It makes your brain to think. Not sitting, limit your TV time to minimum one serial or something. One important serial is what should be used. Rest of the time, you can be active, move around, go for walk, activities, meet your relatives. That's not happening nowadays. The TV serials are controlling the life of everyone. So we are not meeting people. We have very less. Only I think during marriages and all, people visit homes or go for the marriage functions or meet their cousins. So more activity, social activity is more important. Keep yourself active, healthy, and alert. Okay, continue reading, and whatever. That's what actually happens. If I have to say, there are studies that college lecturers have more chances of getting dementia. There is a study which is being done for that, where they found out that those people who were doing a lot of literary work, suddenly after retirement, they stopped doing that, and they generally have a greater risk, because all the brain activities of the brain that was happening, suddenly it has been zipped to zero. Okay, I hope I have answered your question, ma'am. Athira?
Yes, ma'am. Thank you, ma'am. So the next question is, do dementia have any relation with Parkinsonism?
Parkinson disease, there is a dementia related Parkinson's. There is something like that. There is a chances of a person getting, if it is affecting the nerves. Like I told you, it is not Alzheimer's. It can be dementia. Anything that is affecting the brain cells, yes, it will come under the premises of dementia studies, definitely.
Thank you, ma'am. Another query is, Does multitasking increase the risk of dementia?
What is it? Can you repeat?
Does multitasking increase the risk of
Yeah,
dementia?
that's what I'm okay. Yeah, does multitasking increase the risk of dementia? No, no, definitely not. Multitasking will only help you to be active. Yes, but one thing is there, it creates a lot of stress. If you are into multitasking, what happens is generally the advice nowadays it is given is that you focus on one task, completion of one task. When you do multitasking, your brain gets disoriented or it divides into different activities, which creates a what you say, a stress there, and that can actually promote a what you say, a lethargy. You suddenly start feeling when you do a lot of work, different kinds of work at the same time, your brain gets tired, so that is actually straining the brain. That multitasking is not actually good for the body, neither it is good for your brain. But no, it won't definitely not lead to dementia, but it will give stress to the brain. It will mimic dementia. It will, there are certain things which mimic dementia, which are all the characteristic of dementia, but will not be dementia, but we have all these symptoms that is related. And multitasking is one of those stress factors which can create that. I hope, Ratna, I have answered your question.
Thank you, ma'am.
Yeah,
Yes, ma'am.
it's Ratna ma'am from VHD, Institute of Home Science. Okay.
Okay, ma'am. Now, thank you.
Yeah.
The next question is it possible to delay the issues of dementia or how to avoid problem of dementia?
Yeah. Raksha ma'am, it's definitely possible to delay, like I just told you. You have to, minimum, you have to have a 30 minutes exercise movement daily in your life. And if you are walking to your office or climbing your stairs and all, that's a good one. That can be taken up as your activity. Eating vegetables and fruits. Vitamin C actually helps, enhances, the support of not getting Alzheimer's. It will help your brain cells to work well and to be healthy. Having generally not going in for fatty acids or fatty foods, like food that is going to lead you to cancer or
Excuse me,
your
ma'am. Your audio is
hypertension.
breaking, ma'am.
Can you hear me
Yes,
now,
ma'am.
Adra?
Yes.
I'm very sitting very close to the
Now it's
laptop.
very clear, ma'am. Please continue, ma'am.
Okay. So all the dietary conditions that you maintain for your heart, for your that is hypertension, cardiac, and also for diabetes is actually good for your for actually delaying or avoiding having dementia in your life. So that is. But if you have what do you say, somebody in your family has already uh, been prone to dementia, then yes, there is risk factor in your family. So due to hereditary reasons, and so you have to be very, very cautious. Such people have to be very cautious with their diet lifestyle, so that they cannot afford to take risk. There are chances, more chances of them getting dementia. Okay.
Thank you, ma'am. The next query is about the limitations in the treatment of dementia in the Indian scenario.
Yeah, Dr. Gayatri. Yes. Yes. Yeah, there are lots of limitations for treatment of dementia in Indian scenario. One thing is it happens after the age of 65 years. You have to understand the first point. So it is after retirement. So when it is after retirement, it is actually a burden on the family. If it is coming sometime when you are healthy or when you're working, when you have an income, you're looking for treatment. So first thing is, because the age is the factor, people generally tend to overlook the seriousness of the condition, and it is only understood when all the symptoms are at its highest, when they start wandering. You might heard of some getting out of the railway station and walking or getting, they might be sitting in the front veranda, and after some time you don't see them, and later on somebody will bring them from somewhere, some long distance. They will go and sit with somebody, and they will be drinking tea, and the person will be shouting. There are a lot of incidents. So what is happening is that the social life is not there here. So in Indian scenario, what is the main limitation is that generally people will consider it as an aging process, number one. Number two, they will never consider it as a disease. So when the disease is identified, it's really delayed. So to control the progression of the disease. Thirdly, there is as such, the medication, since it does not bring a cure, there is lot of, uncertainty in people. It's like, giving medicine, buying the medicine for no reason, and there is no effect. That is generally the perception of the people. So they think, why buy the medicine? And when they don't buy the medicine, the person gets aggressive, agitation starts happening, more wandering will happen, more complications starts happening. So this awareness of dementia is one big issue in Indian scenario. And that is one of the hurdle that we have to see when treatment of dementia. And this, as part of this, the awareness that is happening now is, see, everybody will think about aging itself. When if you attend a seminar on aging, it's all about distress, isolation, depression, and all that. Now think that person cannot feel about that. Now this is the second stage of aging, where they don't even remember, they don't even know how to react. And it is so very dangerous, but people are not careful. They just link it with it. It was not even listed under a problem. Only very recently, in 2010 and all, Dr. Roy and all initiated activities to involve it, take it as a serious considerations. So yes, the biggest limitation of dementia is not having awareness about it and not acting at the proper time, which is causing serious problem for the dementia scenario in India. Even now, there's a place for paralysis. There is, your palliative care. It is coming under palliative care and all that. It is not specifically considered. I hope, ma'am, I have answered your question.
Yes, ma'am. Thank you, ma'am. So the next query is that, is it due to menopause and its associated hormones, women are more prone to dementia?
Actually, Sri Lakshmi ma'am, in women, the menopause, yes, it is one of the doors opening to all the risk factor for women. Once menopause happens, there are more risk factor of the women getting heart disease. They are more prone to hypertension. So all this, yes, it is definitely a door opening, for the women. Till that time, she's safe. And now also one reason is, removal of ovary and uterus. That is actually not helping the women. It is actually bringing them to more risk factors, but of course, helping them in managing their, life. So yes, what you say is true. And yes, that is also one of the reasons why women are more prone to dementia. But the major reason is they take life very lightly as soon as they age. Women don't take themselves seriously as they age. They don't age gracefully. And when they age, they suddenly age. After retirement, it is like getting all the 10-20 years they were holding back at one go. And that brings a lot of complications in their life.
Okay, thank you, ma'am. The next
Yeah.
question is,
Yeah.
are audiobooks safe?
Pardon? I'm
Are
not able to hear
audiobooks
it.
safe? It's from Vishakha, Karnataka.
Audiobooks.
Yeah,
Okay,
ma'am.
okay. You're talking about audiobooks, no? Okay. No problem. You can see, even if you're listening to it, your brain has to activate images. You have to relate to it. You are trying to imagine. So your brain is acting, the whole scenario is about making your brain active. When you're watching a movie, there's nothing your brain has, or nothing left to your imagination. Everything is there. If I have to give an example, if you read the book by Chetan Bhagat and if you see the movie Three Idiots, you know, it's the same movie and the same book, same story. But if you have read it first, the images that you had in your mind and the movie will be totally different. Most of the people who have read the book will say the movie is not at all good. It has not done any effect. So it's like, your imagination, your thoughts. So it is very good. Audio also is good. Audiobooks are also good. Do anything that will help your brain to work. Yeah.
Okay, ma'am. Thank you. Is there any more question? I think that's all from the participants. Thank you, Dr. Nisha Vikraman, for a wonderful presentation. And thank you so much for your valuable time and for answering all the questions. Thank you very much, ma'am. Now over to you,
Thank
Nikki.
you, Athira.
Nikita, over to you.
Thank you, Atira. Am I audible?
Yes, Nikita, please.
Yeah, Nikita, you are.
Okay. So thank you, ma'am, for your wonderful presentation.
Thank you.
Now
It
I
was great fun
invite.
being with you.
Thank you, ma'am. Now I invite research scholar Ms. Aparna Nath for delivering vote of thanks.